Welcome back. It's Dr. Jen Ferboni, Doctor of Physical Therapy, better known as DocJenFit, owner and founder of Gen Health, your platform for all aches and pains, or just wanting to feel good in your body by following a consistent routine. Now, today we are going to really focus on pubic symphysis pain or symphysis pubis dysfunction, whatever you want to call it, is so common during pregnancy where you get that pain right at that front of that pubic bone. And this is so common because we have movement happening at our entire body, really, but at particularly our pelvis. We have hormones that are creating this relaxation response and laxity around the ligaments, increasing the movement, especially if you're already a hypermobile person and then you're pregnant and now experiencing even more hypermobility. This can be prone to increased sensitivity within an area, increasing pain symptoms. Now, what's super crucial is not that you're doing more mobility to combat this, but we actually want more stability. So this is where it becomes so crucial that we're exercising and we're getting strong within our body to help support these changes that are happening and hopefully help to reduce some of those pain symptoms. Okay, so I'm going to take you through some exercises that can be really helpful. This can be something that you can do all together or exercises that you can sprinkle in during a workout. And then I'll talk about how I've really helped to combat this and what program I'm following myself that I do always throughout my pregnancies. So we're going to grab a little pillow here. It doesn't have to look like this one, but something small that you can kind of fold together, or it could be more of like a squishy block or a squishy ball. You can always use as well, like a little Pilates ball, if you have that handy. So we're going to lie on your back. If it is not comfortable to lie on your back, you could be more at an elevated surface by using like a wedge pillow or stacking some pillows up. Know that it is okay to be on your back for a short period of time during exercise, but you always have to listen to your body. So if you're getting symptoms like you're feeling dizzy or you're feeling nauseous by lying on your back, then that's when you want to start to prop yourself and not lie all the way on your back. But think about it. Every time we get an exam, you go into the OB office, they have you lie on your back, they're measuring your stomach. Doing this for a short period of time for an exercise is totally safe and fine. You just don't want to be sleeping in that position, preferably, especially as you get bigger with the baby and belly growing, because that's when it can start to push on some major vessels. Okay, so we're going to lie onto your back if you feel comfortable again, and squeeze. We're going to start by squeezing a pillow. Now, have your feet not too close to you, but more at a comfortable position. They're going to be relatively close because we're going to bring our knees in together. As you bring your knees in together, I want you to think of hugging and wrapping into your baby. Okay, so we're going to do that, but with a deep, long exhale. So as I squeeze the pillow, I'm going to think of hugging my baby with my belly. So it's going to look like this. Big inhale. Big exhale, squeeze. Hold, hold, hold. Breathe in. Breathe out. Squeeze even more. And relax. Breathe in. And hug the baby. Squeeze. Hug, hug, hug. Everything is coming in. Breathe in. And hug a little bit tighter. Let's try just one more of that. If this is feeling okay, this is when you know you can move on. If it's not increasing your symptoms, okay? Breathe in, breathe out. Only squeeze as much as tolerable within your pain level. So if it's too excruciating, you won't be squeezing in quite as tight, but hopefully helping by wrapping into your transverse abdominis and you're using your ab muscles to help with the inner thigh muscles can help to reduce some of those symptoms. Okay. And you can actually hold that a little bit longer like we did on that last one to help as well. Now, the next one that we're going to do is a single leg kind of press march, but we're going to use the pillow here again to kind of help facilitate this cross body reach to increase that inner thigh activation along with our obliques and transverse abdominis. So again, as I lift my leg, I'm going to think of that deep, long exhale and wrapping of my baby, hugging my baby. Breathe in, breathe out. Hold that. Breathe in, breathe out. Wrap and hold. Breathe in, breathe out. And then come on down. Let's try the other leg. And we're going to, again, breathe in, breathe out, lift. Push into that pillow, push into that leg. Breathe in, breathe out. Breathe in, breathe out. Now, some of these can be very sensitive because we're starting to increase this, what's called your adductor, your inner thigh that connects right into that pubic symphysis bone. So it could be really uncomfortable and start to elicit symptoms. If that's happening, you want to back off and you don't want to go quite as much, or you might even skip the push altogether. Okay. So maybe you're just coming up here and you're really just thinking of the wrap. Breathing in, breathing out, and you're not yet pushing a lot of pressure. Okay, so you can always back off the pressure as you need to. Breathing in, breathing out. Breathing in, breathing out. And let's just try one on the other side. So again, modulate for your pain and your current comfort level. Breathe in. Breathe out. As you breathe in, you're holding. You're not necessarily letting it all out. You're just taking your breath in from that rib cage, breathe out, wrap into that baby. So it's really a hug for that baby that's going to help to get those lower transverse abdominis and cross along the line. So we want to cross from those abdominals into that inner thigh to help create that stability at that pubic symphysis bone. Okay, so that's really what we're trying to do here. Okay, now if you feel comfortable with that, if that was okay, you are going to try to now bridge. So we're going to press into the leg as I lift into a single leg bridge. So breathing in, breathing out, and it's just a little bit of a lift, and then come right back down. Breathing in, breathing out, hug that baby, come down. If that is like, whoo, that is way too much, just start with that adductor squeeze that we did in the beginning and press both elbows down as you lift up. Breathe in, breathe out. Breathe in, breathe out. And you would do both legs at the same time. Okay. But again, if you feel comfortable, go to that other leg again. Breathe in, breathe out. It doesn't have to be very high. Come down. Breathe in, breathe out. Little push into that leg. So we're still working that inner thigh, and come down. Let's try 2 more on each side if you are still with me. Otherwise, you're doing both legs. Breathe out. Come down. Now we're getting that glute and kind of that back body while still working across that joint into that inner thigh. Breathe in. Breathe out. Breathe in. Hug that baby, deep breath out. And then come down. So you don't have to hold that one either. You can just do reps and go up and down to kind of feel where it feels best within your own individual body. Now, last one that we're going to do is a Copenhagen plank. This one is tough. Okay. And what I noticed pretty early on in second trimester is that I needed to modify this Copenhagen plank to a much lower surface because I was getting some bulging out into the middle of my belly. And this is really what we want to watch are we getting like this coning effect happening only out into the belly with any of those exercises that I was doing? That's why we really want to hug. And that's why we're modifying the level of it, because we don't want to get into this coning effect. Not that it's bad, but we just don't want to spend a lot of time there. If we're seeing it, we know we can modify it, because that means that we're putting a little too much pressure out into the midline where the tissue is already getting so stretched. And we can modify that position to how can I utilize more of my muscles so that I'm not just putting pressure in one area. Okay. Again, not bad. Super normal, going to happen during pregnancy, but we always want to see, okay, what can I do to kind of modify that? Now, I'm going to show you how you can use a block. Again, you can use another Pilates ball. You can use a pillow. You can use different things. So it doesn't have to be a block. But by utilizing a little bit lower of a surface for a Copenhagen rather than like a bench or a chair. But if it's good within your body, you can always start there. And then I'm going to have something to press into as well. So when I'm pressing into it, I'm kind of helping to hug and utilize all of my muscles to my abdominal muscles to help so I'm not just coning right in the middle of my rectus abdominis and causing too much pressure out. Okay. So that's what I really want to watch here. Now, ways to modify this is that you are going to push down and keep this leg on the floor as you go up. Okay. So you do not have to come into a full Copenhagen where your leg is lifted, especially if you're having a lot of symptoms in your pubic symphysis area. That's going to be too aggressive. Okay. So even just pressing down into that leg, you might be starting here and you might be like, oh, that's a lot. So I'm just going to start by pushing my knee into a pillow and not even lifting into a side plank, holding that isometrically for about 5 to 10 seconds, breathing. And you'll do that about 5 times on each side. If you can tolerate it, you're going to press into the block and lift into a side plank as you push that knee down. So I'm going to push my top knee down and I'm going to try to lift. And I'm going to hold here 5 to 10 seconds and then come down. If you're like, okay, that's feeling better, I can do a little bit more. That's where you're going to lift that bottom leg. Maybe you're just lifting the knee. So you're going to press down and you're going to lift just in the knee. Maybe you can lift that entire leg. You can come up. Oh, I can't quite do that anymore. And you're going to lift the entire leg. So you have to find where your body currently is. So let me show you again on the other side, just so that we're on the same page here. We're going to come. There's so many different levels. Because again, when you're in pain, you got to find what works for you, and it's not for everyone. So first level, pressing my knee down, just pushing down and just holding there 5 to 10 seconds, 5 times. If I can do that, if it feels like it doesn't increase pain, it feels okay. I'm going to then push into the block and lift into a side plank, keeping my leg down. I'm going to push and hold 5 to 10 seconds. If that feels okay, I'm going to lift and I'm going to lift my knee up, keeping my foot on the floor. Push into a block, breathe out, hold 5 to 10 seconds. If that feels okay, I'm not going to do it, but you could do it. Lift the entire leg off as you lift up into that Copenhagen plank. So many ways to modify, to listen to your body and to start to build that stability. Again, it's not about, okay, I'm feeling pain. I just need to stretch it out. I just need to relax it out. I need to stop moving. No, we want to increase movement. We want to feel that stability. And that's why when you're rolling over in bed, squeezing a pillow between your legs helps so that we're not lifting one leg over another, or getting out of the car, making sure our legs are together. These are all ways that we can start to reduce some of that strain and tension around that pubic symphysis. And what helps with that is increasing that stability of that inner thigh. So of course, we still want to work on our hamstrings, our quads, on our whole hips, but getting that abdominal to groin area stronger, especially in first and second trimester, before you even get to third trimester, is going to be key. Now, something that I've been following for my own body during my last pregnancy, and something I'm doing during this pregnancy, is following our full body low impact plan on Gen Health. I do it myself and I love it because it has your core, your muscle activations we normally wouldn't do, strength workouts, which are only 30 minutes and can be done by home. And I do the entire thing with you, plus some mobility that is targeted to the entire body. So this plan is, it's just one of my favorites. And I've gotten so much amazing feedback, not only from anyone, but from moms, especially, and moms who are pregnant, and how much it's helped in birth and recovery, because we're getting our pelvis strong in all different directions. And this is so crucial to help maintain that stability and strength. Remember, we're already becoming hypermobile even more during pregnancy. So maintaining that strength and stability, especially to help you for afterwards when you're taking care of a newborn, is so crucial for the body. So I'd highly recommend check out, you get to start a week free. Okay. And there's 3 phases, so that once you finish the first 30-day phase, even if you don't do it for 30 days, you have a next 30-day phase and a next 30-day phase. So you have something to continue to follow throughout pregnancy. And this is why I love this plan. It is so good. And it's been so helpful within my body to reduce any of the strains and pains that I'm feeling. So I want to give you code OPTIMAL as well. This is going to get you started for your first month for just $20. Code OPTIMAL at checkout. Start a week free and just try it. I promise you, you're going to feel a difference. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.